Welcome to my channel. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about, can hormonal IUD cause infertility? By the end of this video, you'll know what an IUD is, how the hormonal IUDs work, how quickly fertility returns once discontinuing IUD use, and some of the risks involved with IUD use. So let's jump on in. All right, so we are talking about IUDs. What is an IUD? First off, that is the short for an intrauterine device. And so when we think of the uterus, we're thinking about this, okay? And so hopefully you can see this well. Here is an image of the structures in your pelvis, and particularly the uterus, okay? This is the uterus. We have two fallopian tubes. We have two ovaries. And so intrauterine means inside of the uterus. And I really want you to clearly understand where an IUD is placed, because I've heard that my partner feels the IUD during sexual activity. And I'll tell you why that cannot be. The reason is when an IUD or intrauterine device is placed, it is sitting in this space inside of the uterus. Down here is the vagina. And so during sexual intercourse, while we may have activity here in the vagina, we do not have any activity inside of our uterus. And so there is no way for your partner to feel an IUD if it's inside of the uterus where it's supposed to be, because the vagina is far away from that device. Now, intrauterine means here. This device is a T-shaped device, and it's a T-shape because it should fit the natural groove of the inside part of your uterus. And so you can fit a T in here, right? Like you can see the arms will go here, the shaft will be here. And so an IUD device sits inside of your uterus in that space. Now, if an IUD is misplaced, for instance, a misplaced IUD can be in the muscle of the uterus. It could also fall or be lower inside of the uterus. And so if it's misplaced, it could potentially hang inside of that vaginal space in a way that your partner may be able to feel. Typically, that shouldn't be if it is in a normal location. There are multiple different types of IUDs. There are hormonal IUDs, and so those available at the time of this video being done, they are the Skyla, Liletta, Kylena, and the Mirena. And so these are hormonal IUDs. And the hormones that these IUDs release in your system are of progesterone. This is the protective hormone. This is a hormone that is very helpful for the female reproductive tract. And so progesterone can be very helpful to have and be very helpful for your system. Now, there's also a non-hormonal IUD as well. This IUD has no hormones in it. It's called the Paragard. And so it is made out of copper, and for some reason, copper inside of the uterus leads to pregnancy protection. But specifically in this video, we're talking about hormonal IUDs and whether or not they can impact your fertility. So let's talk about it. So this hormone, specifically a type of progesterone, is called levonorgestrel, and it works wonderfully for those people who may want contraception, meaning to block pregnancy, but at the same time may decrease bleeding with cycles. So many people love IUDs because they don't get cycles while they're using it. These IUDs actually provide you with the greatest amount of protection when it comes to fertility. So if it's your contraception of choice, it is a good one to use. But oftentimes we have concerns about fertility. But before we talk about that, I do want to tell you how these IUDs work in general. They help to prevent sperm from entering the system and being able to pass through to get to the egg to fertilize it. It helps to create a thinner area on the inside of your uterus so that a pregnancy that could have potentially occurred has a harder time sticking because the area inside is unfavorable. It also may decrease your ovulation as well as the amount of mucus that your cervix will produce, which in and of itself may block pregnancy and sperm from entering your system. Now, during the time that you're using the IUD, we do want your fertility to be decreased, right? That's the reason why we're using contraception. The problem though is that once we stop the IUD, what happens to our fertility? And I'll tell you what the statistics or what the data shows. In general, when you stop the IUD, you have it removed. And this is the hormonal IUD specifically. This does not apply to the non-hormonal IUDs. Once you remove the IUD, your body now does not have the influence of this synthetic progesterone or hormone in your body. Your body then will start to remove that out of your system and now pull from your internal hormones specifically. This means that it will pull for your estrogens, it will pull for your progesterones, and what would be a normal yo-yoing effect between the two. When your estrogens are high, your progesterones are low. When your progesterones are high, your estrogens are low. And so your body literally goes through this balancing act. Oftentimes, it will take 2 to 3 months after discontinuing your IUD for your fertility to be back on track. Therefore, it is important for you to know that discontinuing or using, I should say, an IUD does not lead to a long-term infertility situation for you. Now, it's important for you to also understand that every day from birth, your fertility is decreasing. And yes, I said from birth because as females, we are born with all the eggs that you will ever have at birth. At birth, a baby girl has millions of eggs. At the point of puberty, she now has about 500,000 eggs, which means during her first 10 years of life, for instance, she's lost eggs, therefore losing fertility every single day. As you go through puberty, you continue to lose eggs every day. So if you happen to use contraception for 15 years, when you discontinue that contraceptive, your fertility has gone down over the last 15 years the entire time. And so your fertility is not at the same level when you discontinue the medication compared to when you started it. That is a natural biological change and a process that will happen whether or not you use contraception. And I say that to say, some people may think that using contraception will decrease your fertility because you're using the medication. And that is not the case. You're losing your fertility a little bit every day because of living and for being alive. This is a natural process. Whenever you discontinue the IUD, your fertility will go back to where your fertility naturally is at that point in time. Now, 2 to 3 months after discontinuing, you may notice that you have irregular cycles, unpredictable cycles. You may start noticing that you're having changes with acne. You may be having a little bit of change when it comes to how you feel and your mood. That's because your body is adjusting to not having the medicine in your system anymore and starting to use your internal hormones primarily for menstrual regularity. Most people who have no history or problems with regular menstrual cycles will then to begin to have their cycles again as regularly as they did before. If you use the IUD because you had irregular cycles previously, when you discontinue it, you will still continue to have irregular cycles. Lastly, I want you to know that sometimes because of our lifestyle and things that happen naturally in generally, what happens is that you may have developed a problem during your lifetime that may lead to you having less fertility. So whether it be diabetes, hypertension, you can have cancer and different things happen in life. And it could be while you were using the IUD. Either or any of these situations can then lead to you having fertility issues after discontinuing the IUD that are not specific to the IUD itself. I hope this makes sense to you today, and I want you to be encouraged and know that give yourself and your body a few months after using the IUD for your fertility to return. And once it returns, you'll be able to track your LH surge, you can track your ovulation, you'll be able to get pregnant as you normally would if you were not on contraception before. We just need that 2 to 3 months for that transition to happen. And so I'd like to put some stats in before we close, just so that you know that the data supports what we're talking about today as well. There is an 85% chance of pregnancy occurring 1 year after discontinuing various types of IUDs. And that's for any of the ones that we talked about. 85% is very close to what would normally happen for people who did not use an IUD. In general, about 90% of those who are having regular sexual intercourse consecutively, especially around the time of ovulation, will get pregnant within the first year of trying. And so 85% is not only really close, but this is considering that you had hormonal involvement and discontinued that. So there is a high chance that you'll get pregnant after discontinuing IUDs. The research has shown that long-term use of IUDs, especially in nulliparous women or women who've never given birth before, may be associated with a slight delay in achieving pregnancy. And this is long-term use of IUDs. And so, while there may be a slight change, this does not lead to infertility. Just need a little bit more time in achieving pregnancy. Now, if you have concerns about using these IUDs and all the hormonal changes that may occur because of this and your fertility level, this is a great time for you to have a conversation with your doctor, who will then be able to look at your comorbidities, your age, your history, and put all of these things into a good picture for you so you know exactly what your risks are when it comes to using an IUD. In general, I recommend asking about the risks, the benefits, and the alternatives so that you know what your risks are and what to do about them. I wish you well in your journey to fertility. And if you have questions, I want you to drop those questions below. And listen, while you're here, I do want to offer you a free copy of my ebook, Hormones Don't Lie. This ebook will dive into hormones and the changes that happen because of them. And so this is of help when you're trying to be empowered and trying to get your body to a specific place. If you'd like that, click the link below this video and I will send it right over to you. Thank you so much for listening in today. I hope this was helpful information. And again, please share with someone who may need to know this information, or share a comment below so that we can all benefit from what you've experienced and we can share it together here. I'm Dr. Perkins, and it's a pleasure. Take care.